It's often a myth that I hear a lot from patients, family members, caregivers, that depression is something that you can just fight through, push through. And it's often very, very invalidating for the patients. It's important for you to consider even mild depression an important medical condition to treat because, one, you deserve the treatments. Two, no one deserves to be suffering through any medical conditions for which we have treatments for. And three, you wouldn't ask people with mild asthma or mild diabetes to just suck it up and go through it. You would want them to get treatment. And it's the same way in which even mild depression can impact people's lives in really meaningful way. Untreated depression can carry a wide myriad of risks and comorbidities. So we know that folks with untreated depression may have more medical risks, such as worse cardiovascular outcomes. They are more likely to have diabetes. And for folks with those medical conditions, their physical health is also worse. Since depression can impact the mind-body connections in which symptoms that you're experiencing may translate into having no energy, sleeping all the time or not sleeping at all, not wanting to do anything at all, and just feeling miserable and really, really forlorn all the time, that can increase your risk for having a substance use disorder, because oftentimes people would want to numb the pain of their depression with something more immediate. People with major depressive disorder can have increased thoughts of wanting to hurt themselves and their lives. And it's really important to manage concurrently both of those symptoms because they can fluctuate throughout the course of the treatments. And it's especially important to let your physicians know if your thoughts of wanting to hurt yourself or end your life is becoming more frequent, more intense, or more vivid with clear plan and intention. Oftentimes, when I'm meeting with people with major depressive disorder, I often have a really frank conversation with them. The depression, untreated, can have profound consequences on your life. And with treatments, it can get better, but it's often not a guarantee. So it's more about how can we better match what you want to do, what you want to accomplish, and what are some of the current barriers that are in place, and how can we navigate that together. If you or your loved one is having thoughts of self-harm or suicide, please reach out for help. Call the Suicide and Crisis Lifeline at 988 or go to your nearest emergency department.